Welcome to Spotlight on Sherburne Business. Today the spotlight is on Carol Pietromonaco Murfin, who opened her office last year, April of 2011. Before we greet Carol and before you meet her and get a little bit of knowledge about PT in Sherburne, I just want you to know once again that the Sherburne Business Association has been established to familiarize all the people in Sherburne and in Dover about the many businesses that we have in Sherburne. We have more than 40 members of the Sherburne business community, and we are there to promote communication between all the various businesses there are in Sherburne, and also to strive to develop a better understanding of the purpose and benefits of the local businesses. One of the other things is we want to create a well-informed charitable organization dedicated to serve the many businesses and social needs of our community. Now, welcome, Carol. I just want I want to thank you for helping us get the spotlight shining here in Sherburne on Sherburne businesses. And I want you to tell us a little about your facility. I know it's named Back to You Physical Therapy and Sports Medicine. In this segment of the interview, we'll find out where her practice is and a little bit more about it. Can we start off with your office address?
Sure. At 19 North Main Street on the first floor, and that's in the Sherbourne Crossing building across from the fire station where the Walgreens is, and also Sherbourne Family Dental is.
Okay, you can't miss that building in the middle of Sherburne.
Nope.
It's also known as Sherbourne Crossing, I know. And it's a very nice facility. Can you give us an overview of physical therapy?
Yes, I can. Physical therapy is the type of treatment you may need when health problems make it difficult for you to move around or to perform your daily activities. Usually you have pain of a musculoskeletal nature, and that makes it difficult for you to function. And physical therapy can help with this and get you back on your feet again.
Okay, well, it's good. Having been through a little bit of physical therapy myself, I know that you do an awful lot to get people back into normal physical health. You have 15 years of experience. Was this in a specialty of physical therapy?
I have a varied experience. I've worked in acute care hospitals, treating people immediately after surgery, within hours or days of their surgery. I have experience working in rehab, which is usually more of a subacute care, a little bit after surgery, maybe 2 weeks after surgery. I've experienced working in home care, so after they've been home from a surgery or an injury. And my last 10 years have really been working in outpatient, which is what I'm doing now, having a clinic and treating people that are, a little more fit, that are living at home, that can come to the office to have a bit more aggressive physical therapy done.
I see. Where did you do your training? What's your educational background?
I'm originally from Montreal. I grew up there. And so the educational system's slightly different. We do high school until grade 11, and then we go to a college whereby I did a degree in health sciences, which was much more like a pre-med program. And then I went to McGill University for a bachelor's in science in physical therapy. Then I moved here. I was actually recruited for physical therapy here. It was meant to be a 6-month stay and turned into 15 years. Obviously, I liked it very much here. And a number of years after, I think it was in 2001, I decided to do my master's in business, and I did that at Babson College in Wellesley. And I did that as an evening program while I continued to work as a physical therapist.
You certainly do have a good background. That's great. I know McGill is one of the best universities in Canada, and having been there once myself, I know it's a very beautiful spot to spend some time. How about your new facility? How can you and your new facility help the business community?
Well, as I said, a person may seek a physical therapist if they're having some sort of an injury, shoulder pain. Perhaps they have been doing a sporting activity such as tennis and strained a shoulder, or perhaps they're runners and have strained a hamstring. Those are very common injuries. I also work with a lot of the orthopedics in the area, so certainly if you've had any type of surgery, knee replacements, or even just a simple knee arthroscopy or shoulder rotator cuff repair, then I can work with those patients as well. I have a particular interest in treating back pain as well, and have had the experience in a previous job of working very closely with a physiatrist who treated a lot of back patients, and I saw a lot of his patients, and therefore have a particular interest in that. I'm also a certified Pilates teacher, and I tend to use a lot of Pilates in my core strengthening for my back patients. I also do a little bit of yoga, so try to kind of make it a little more interesting and try to add some different core principles from those specialties as well in my practice.
Do your patients need to have referrals from an orthopedic surgeon, for example, or can they come to you directly as a primary care patient?
In the state of Massachusetts, to see a physical therapist, it's actually a direct access state, which means that you can come and see a physical therapist directly. And most patients that have insurance plans that are of a PPO nature can do so. Unfortunately, some of the insurances, for example, a Blue Cross HMO or even a Medicare patient, would probably require a referral from either their primary care physician or possibly an orthopedic surgeon in order for the insurance to approve the physical therapy. But again, if you do have a PPO plan and you're just wondering whether physical therapy can help, you can certainly just come in for an evaluation. I also offer about 10-minute free consultations. So if you're unsure whether physical therapy is something that can help your injury, then you're welcome to come in and make an appointment just to have a brief conversation with me. And if you discuss your symptoms with me, then I might be able to let you know whether physical therapy might help.
I see. So your first visit is usually an evaluation, and how long are your clinical visits usually? How long does it take to evaluate a patient, and then how many months, perhaps, are people in therapy?
Yes. Well, on the initial evaluation, people should wear kind of loose-fitting clothes and bring their insurance card and a prescription if they do have it from their doctor. Then the session lasts 45 minutes, and so do the treatment sessions. And on average, I see people about 2 times a week for about 2 months. I think that would be kind of a general, of course it's specific to your injury type. It could be less, it could be more, but that's kind of a good average.
Do you see everybody on an outpatient basis? You don't do home care visits, do you?
No, I do not. So the type of clinic that I have, as you mentioned, is an outpatient clinic. Mm-hmm. And so in the continuum of care, so if you were hospitalized, you might go from a hospital surgery. Let's take a total knee replacement as an example, because that would be a good example. You might have the surgery in the hospital, stay a couple of days in the hospital. Then you might go to a rehab setting if perhaps you were unable to, perhaps if you lived alone and you were unable to go home and you didn't have help to do some of your tasks at home. Then you would go to home care setting, which would be performed, the physical therapy there would be performed by a visiting nurse association, a physical therapist working for a visiting nurse association. And then you would come to me, which would be an outpatient setting. And usually at that point you're kind of healed enough and ready to undergo some more rigorous exercises to get you back functioning.
I see. Can you just summarize the important facts for becoming a patient at Back to You Physical Therapy and Sports Medicine? Let's put it this way. If I were just out of the hospital, would I call your office for an appointment for something like a total knee, or do I show up and just you evaluate me? How does that work?
Yeah, well, basically, if you were a total knee replacement, you probably would have a referral from your doctor. You would have several follow-up appointments. So the doctor would probably say, okay, you're at the point where you're ready to undergo outpatient physical therapy right now. And then you would call my office, and within 24 hours, I could have you come in for an evaluation appointment, and then we would set up appointments from then.
Gotcha. Okay, well, we're very excited to have you in Sherburne. What made you choose this location?
Well, to be honest with you, I fell in love with the building. The space is so beautifully lit. There's a lot of sunlight, and as I said, I've been working for 15 years, and I worked in a lot of different settings, and most of the time, physical therapy clinics tend to be located in a gym-type setting, or perhaps in, I know you worked at the hospital, so it tends to be in, let's say, the basement of a hospital, not very well lit. And so certainly I wanted to create a different atmosphere for the clinic, and wanted it to be almost kind of spa-like and soothing and calming. I find when some patients are in a lot of pain, it's nice to come to a nice environment to do the physical therapy, and I felt like you could still get excellent care and might as well do it in a nice space as well. The second reason why I chose Sherburne is because I really just enjoyed the community. I had an experience of working in a similar type community before, and enjoyed that I would treat, let's say, the mother, the father, and the children as well, and I just really enjoyed the sense of community that Sherburne offered.
Very good. Back to you, physical therapy and sports medicine. An interesting name. How did you come up with that?
Well, I cannot take the credit for that. My husband's been very involved and very supportive in the business, and he actually came up with the name. I think he's a very creative person, and he had a lot to do with designing the space as well, so that's been quite nice to have his support. And the name was really, a lot of people think perhaps I just treat back patients because they see the name Back to You and assume that it's a clinic that specializes in spine care. And although, again, as I said, this is an interest of mine, the name was really created because the intention was to get the person back to feeling like themselves again, get back to being you, and just get back to doing all the activities that you like to do.
How about equipment? What are you prepared to do as far as your office is concerned? What do you have in your office that is required to rehabilitate someone?
Yeah, absolutely. Well, our office is handicap accessible, so it would be easy for somebody who is either on crutches or perhaps even wheelchair bound, using a walker, or even maybe having a protective boot or something to come in, because we are a first floor. We have a recumbent bike, we have a treadmill, and I tend to like to use resistance bands and free weights and body weighted resisted exercises. As I said, I'm a Pilates instructor and I do use yoga too, and so often your own body weight can serve as an excellent core strengthener for yourself. And for example, if you were to do a push-up, instead of having to use a weight machine, your own body weight could serve as excellent resistance to strengthen you.
Okay. Well, tell me, is there any difference, or is there something different or unique about your physical therapy business?
Well, I think both my husband and I, when we kind of created the concept, we really wanted it to be kind of a technologically advanced company. And so we're actually all Apple-based, all Mac-based, and we use an online video exercise program. So what would happen is if you come in, and most often I will give the patients some homework to do on their own to complement the work that I will do with them. And so what this video exercise allows us to do is to upload our own videos. So for example, recording myself teaching an exercise, and then the patient can play this video in their home and somewhat do the exercises alongside with me. So have me giving them verbal cueing and kind of a visual to do the exercises with. And you also can just print out those exercises as well, so they can have that format as well. We offer one-on-one treatment sessions, as I said, of 45 minutes. And so often a lot of clinics are unable to offer this, but since I am kind of just starting out, I'm able to do this at this time, so which is wonderful. I also offer Pilates classes on Saturday mornings for patients and also for people that are not patients, people of the community. And the goal of the Pilates classes is really more of a beginner's Pilates. It's, as I said, Pilates is a wonderful core strengthener, and so if anybody has had an injury and is a little apprehensive about returning to exercise in a gym type setting, what I'm doing is offering these classes as an introduction to kind of getting back into that routine and then being able to graduate into more of a gym type setting or perhaps a more advanced Pilates class after. And so far it's been really wonderful and been really well received. And I think people feel really comfortable knowing that I can modify their exercises to avoid re-injury or avoid injury.
So you have really a way of keeping people up to date in physical therapy, and after their treatment with you, do you recommend that they go to a gym and work out, or do you give them an exercise treatment plan for home?
Yes, absolutely I do, and I do work with some of the personal trainers in the area and some of the local gyms. Also, I do really feel that physical therapy needs to be done as part of a coordinated care effort, and so I do have very good relationships with some of the doctors in the area, the orthopedics in the area, but not only that, I'm a very holistic practitioner, so some of the chiropractors in the area, some of the acupuncturists, and then of course the personal trainers in the area are wonderful as well to be able to kind of continue some of the work. So.
Looks like you have a very complete program. Could you just summarize once again where you are located, what your main thrust is as far as physical therapy is concerned, and what you think the future holds for you?
Yeah. Absolutely. Well, as I said, I'm located at 19 North Main Street in Sherborne, right across from the fire station and next to the Walgreens. My phone number is 508-545-2352 if you'd like to call for an appointment. You can also see us on the web and Facebook as well if you'd like to join our Facebook page. The website is www.back2upt.com, and that's all spelled out as words. In terms of myself, I've been working for 15 years as a physical therapist and have a variety of experience in sports medicine and orthopedic physical therapy. And again, I'm a Pilates instructor. And I guess as far as the future holds, I hope to be in Sherborne for many more years and to continue to get to know the community because I've really enjoyed them so far.
Well, we know you'll be here for a long time, and we really appreciate you helping the Business Association by doing just what you're doing, and that is showcasing some of the wonderful things that we have here in Sherborne. And I just want to thank you once again from the SBA. And I do want to say that I'm Dave Sorter from the Sherborne Inn, and I'm associated with the Sherborne Business Association, and this program is produced by a combination of both Dover Sherborne Cable TV and the Sherborne Business Association. So thank you, Carol,
Thank you for having me.
See you soon in the office.
Thank you.